It's a very fulfilling specialty, at least for me. When I used to do the obstetric part of it, it was amazing, you know, just being able to deliver babies and things like that. Times change, and then I decided to go and devote myself more to the gynecology. And now I am seeing the patients that I delivered 20 years ago, they are coming back also as my patients for menopause problems and bladder problems and things that I can help them in the other side of the coin. So they feel secure, and I give them that safety net for them to just relax and be open and tell me whatever or ask me whatever they want to.
I like my patients to trust me and to see me as a person, not just a superior medical provider. You know, I want them to be able to open up to me, and that's when I know that I'm doing a good job. We want to look at their whole person. We want to look at all of their cardiology care, and you know, if they have asthma and allergies, and they see other providers. By looking at the whole entire picture and seeing all the providers and all of their progress notes and their tests and all of that, we can kind of really understand the whole patient, and all of that comes into play, you know, in your whole wellness. The urodynamics, to be able to do urodynamics here in this facility, number one, patients are scared to do it just because it's something foreign they've never heard of, you know, so they would be less likely to do it if it's done elsewhere. Here they know it's the comfort of their own exam room where they come to all the time. It's a way to look at the bladder for women who suffer from urinary urge, having to go to the bathroom a lot, urinary frequency, nocturia, which is getting up in the middle of the night, awaking from sleep to urinate, and stress incontinence from weakness of the pelvic floor muscles after having children, or just gravity with aging, and urge incontinence. So people that hold it, and there's a disruption in the sensory ability of the bladder. So they don't sense the urge to void until it's essentially too late and they have leakage. So contrary to what people think, it's always older women, and that's not the case. A lot of younger women suffer from these things. Sometimes it's an underlying condition such as interstitial cystitis, which is a chronic inflammation of the bladder wall. These women may suffer from chronic urinary tract infections because they don't empty their bladder all the way. So they hold on to urine, and in the warm environment of the bladder, bacteria form. So it gives us a lot of knowledge. It's something that urologists just used to do independently, and now in gynecology and internal medicine we're doing them here as well. And it can be also done on men for BPH, which is enlargement of the prostate gland, and men, same symptoms of urinary urge and frequency. Second is, now that we have the ability to do urodynamics, not only can we interpret the test results, but we can manage the patient according to those test results, which has actually changed the way that we manage urinary incontinence and urinary urge. Before, we used to blindly, and I say we, just a lot of medical practitioners, we used to prescribe medications for incontinence without knowing the true origin of why somebody is experiencing incontinence. So this gives a lot of knowledge in that regard and helps us to treat people more effectively and more appropriately.